Before launch, we will go through a multi-layer approach. We've conducted a structured voice of customer study with 300 women across multiple regions, ongoing community engagement, clinician conversation, and pricing acceptance testing. And so far, women did not only understand the concept, they actively asked when their device would be available and showed willingness to pay. Our first user is a health-aware woman aged roughly between 18 and 45, who is actively trying to understand her cycle, women who are often planning pregnancy, or women who are coming off hormonal contraception. And on top of that, women who undergo IVF treatment, or women who are dealing with unexplained cycle irregularities. Our launch strategy happens in two parallel but connected tracks focusing on clinical and consumers. On the B2B side, early adoptions means a small number of highly engaged clinical partners, gynecology and fertility clinics, using our device with specific patient groups, first women with unexplained infertility, irregular cycles, or pre-IVF preparation. They're using the device to support real decisions whether to proceed with treatment, delay a cycle, or stabilize the vaginal environment before conception or transfer. Success for us is when clinicians begin to rely on the data between visits and incorporation it into their treatment planning. On the B2C side, early adoption is a defined group of health-motivated women, typically between 18 and 45, who are actively trying to understand their cycle, planning pregnancy, or managing recurring vaginal health issues that we can target through our e-commerce. These women will use our YON E device consistently, track patterns over time, and share the data with their healthcare professional. The key signal we look for is behavioral change. Women adjusting timing, seeking care earlier, and arriving at the appointments already informed. The important part is that both B2B and B2C reinforce each other. Consumers generate longitudinal real-world data, and clinicians validate its medical relevance. And when both sides start to trust each other and using the information, that is true early adoption, and that is when a medical platform begins to scale. Our strong pull will be when demand starts coming from outside our marketing. Clinicians requesting access, users recommending it to each other, waitlists growing faster than production capacity, and customers asking for availability in new countries before we launch there.